What are oncofetal tumor markers like alpha-fetoprotein or carcinormbryonic antigen, and why do they appear in cancer tissues or cancer patients? Now, oncofetal tumor markers are a group of tumor markers which are usually seen during embryonic development in fetal tissues. But in adult tissues, they are absent or very minimal. But if a person develops cancer, these tumor markers level are usually seen elevated, particularly in the serum of the patient. Now, question is why? Why suddenly these proteins, which usually disappear after birth, they shockingly reappear in cancer tissues? There are two reasons for this. Reason number one, that usually these cancer cells, when they're growing, to grow much faster in much rapid rate, what do? They try to revert back to the embryologic state for the rapid development. This is called de-differentiation. And that's why what happens, a lot of these fetal genes, they get switched on. They start to reproduce. These fetal proteins start to reproduce due to this state of the de-differentiation. Reason number two is this, that we know that fetal proteins, fetal antigens are usually not attacked by our immune cells. So in a way, these cancer cells, when they start to express these fetal proteins, that's a way to avoid the immune attack, immune evasion, they say actually. Because if they express these proteins, oncofetal proteins, the body's immune system would wrongly think that these are the fetal tissues and they're not going to attack them. These are the two reasons why these oncofetal proteins usually reappear in the cancer patients, in certain cancers. Now, we know that what are the oncofetal proteins. One is carcinormbryonic antigen. We see typically is in colorectal cancer, but it's non-specific, can be seen in, like most of the tumor markers, they're non-specific. They're seen in a lot of other conditions. They're seen in lung cancer, breast cancer. Alpha-fetoprotein, they are seen in hepatocellular carcinoma. They are seen in conditions like gonadal tumors or testicular tumor, like let's say yolk sac tumor, mixed germ cell tumor containing yolk sac tumor, they will be seen. So, and nowadays some new proteins has also come. Let's say chondroitin sulfate, chondroitin sulfate oncofetal protein. These are also in the pipeline for getting used up in the practices. So the point is that more like most of the tumor markers, these are also not useful for specific diagnostic, but they have prognostic value. If the level is elevated, carries poor prognosis. They also have, they can be used for treatment monitoring or disease progression. But one thing lastly, I want to tell you that these oncofetal tumor markers are usually less specific, organ specific compared to even other tumor markers which are available. Let's say prostate specific antigens, quite specific for the prostatic tissues. But these oncofetal tumor markers are not at all specific for any organ. Let's say carcinormbryonic antigen. It can be seen in colorectal cancer, it can be seen in breast cancer, lungs cancer. Alpha-fetoprotein can be elevated in the liver cancer, hepatocellular carcinoma. It can be elevated in the gonadal, testicular, ovarian, germ cell tumors like yolk sac tumor or intradermal sinus tumor. So this is the concept that you need to know about the oncofetal tumor markers. Thank you so much.